Welcome, everybody. My name is Misha. Thank you so much for joining me today for our Lunch and Learn. I am looking forward to talking about the complex factors that really enable and contribute to successful meal times. There is so much information related to feeding, so we are just going to touch upon it. We will have about an hour together, 12 p.m. Eastern, and I am in Chicago, so 11 to 12 p.m. Central Time. Here are my disclosures, and I'm going to share a little bit about information about me, and then we'll get started. I went to school at Quinnipiac University. After that, started my career at Kennedy Krieger Institute in Baltimore. Wonderful, wonderful experience. Then moved to New York City and worked in early intervention, early childhood at the Cook Center for Learning. And I've been in Illinois for the last 17 years. I've worked in a variety of different environments. Currently have my own practice, integrated pediatrics. I work with children primarily birth to 15 with mild, moderate, and more involved kiddos too. I really like working with families and children and really linking them with the resources that they need and helping parents and caregivers support their children. Also part of the medical diagnostic team for early intervention at our local Easter Seals, and I'm a presenter to live and full day and webinars for Summit. I am a parent to two boys, 10 and 14, and member of AOTA, Illinois OT Association, serving on the Early Intervention Special Interest Committee, and also a provider representative for the Illinois Interagency Council on Early Intervention. So let's find out who's here today. You guys can use your chat box and share with me if you're OT, PT, speech, any other discipline, how many years in pediatric practice are you working with children in early intervention, early childhood, or school-age children? And how do you feel about your experience and knowledge with feeding? Are you just learning things, have some information, or have been practicing and working on feeding for a while? So if you guys want to add some information in the chat box, that would be great. All right, so with feeding, as we get started, there are so many things involved. It's a complex and dynamic process that really involves several components, and we have to think of all of those and really break it down. When kids are learning how to suckle and suck, breastfeeding, bottle feeding, as they move to cup and straw drinking, how they're learning to move their mouth, biting, chewing, swallowing foods in an efficient way. It's really important. I attended a course that Colette Ellis, speech therapist who's board certified in swallowing and swallowing disorders. She shared it takes 30 plus muscles under the control of 6 cranial nerves and several spinal nerves that convert respiratory channels into digestive tract and back in less than 500 milliseconds. That is so much, right? And so when I heard that, that just really stuck with me. That is a lot happening in a very short amount of time, right? So thinking about that as we're working with our kids, as we're working with our families, when we're working with children in any area, we're also working with parents and caregivers. And so being mindful, and with feeding, as all other areas, a big part of our role is education. So looking at feeding, some major components that I would like to highlight: medical piece. When we're also thinking about that, we're also thinking about the motor skills, the oral motor skills our child has, along with that postural control. So we'll talk about that a little bit. The nutrition and that psychosocial piece, right? That emotional, anxiety, pressure, stress, the parent or caregivers piece in that, what they may be carrying, what they're putting on their child, not ill-intentioned, right? They want their child to get the adequate nutrition, vitamins, minerals to grow. So that piece too. So thinking about those components. When we're working with our families and our children, identifying and highlighting the concerns. So we might want to get, parents often come to us because my child's having difficulty gagging, choking, coughing, vomiting. We might have to ask these questions. Maybe our parents don't know, right? Selective eating. All kids are picky eaters. They just said he'll eat when he's hungry. And so when we hear that, dig deeper, right? Ask more questions. Limited volume, tube feeding, difficulty with chewing or swallowing. pocketing our food, drooling, mouthing, and then mealtime behaviors. And again, that control piece, which can then go into some behavior issues also. So just asking those questions, getting more information. And when we do that, we also, a huge piece is getting that history. That is so important. Even if we're seeing an older child, we need to know, as an infant, did this child have trouble with reflux? Were they getting tube feeds? Were there any significant allergies, sensitivities? How did that child do with breast or bottle feeding? Did they have trouble latching, getting a good solid lip seal around the nipple? What was their suck, swallow, breathe pattern like? Did they have trouble with that? Their tongue, lip, and jaw movements. We just need to get that information. Some of our families, when we do ask those questions, we find out, oh yeah, that child had such a difficult time. We had to switch formulas, or I was breastfeeding, or I was pumping, and then there was just, the child had reflux, and so we transitioned to one formula. That didn't work, so we tried another one. That is very stressful, and that can impact that child throughout. So it's important for us to know. Ask about how that introduction to solids went. Was the child interested? Did they accept it? Or was that child really only able to have blended, smooth foods? And so getting that information, asking about bowel movements, amounts of food, types of food, looking and asking about that positioning for that child, self-feeding skills. Was that child interested in participating in meal times? Or I'm sure many of us have heard, well, we usually have the iPad on and I just feed him. And so that's where that family might be currently. And we're not going to judge, right? We're not going to assume. We don't know. We haven't walked that path with them, but meet them where they're at, right? And then let's talk about, what is our goal? Mealtime should be an opportunity for that child to actively engage in conversation, turn-taking, self-feeding, right? It should be an enjoyable time for the child, the family, if that child's in school, with peers too. So getting that information is very, very important. We also, as stated before, that medical component, there's so much going on. And if there is something medically going on, we need to address that. We need to support our families with getting the information and referring them or sharing with them who's the right person to go to, or what questions do we need to ask the pediatrician? What do we need to make sure we're sharing? Respiratory system, that breathing, again, as those younger kids, those infants, coordinating that suck, swallow, breathe pattern is very important. Looking at the musculoskeletal system, that structural development, that posture. If we all know, if we don't have that good proximal strength and stability, it is very hard for us to do distal movements. That includes our mouth, right? So much fine grading and coordination with that. Our neurological system, motor coordination, strength, and endurance. Some of our kids fatigue, right? And they might tell us, oh, well, any meat, he just doesn't like them. He just, spits them out, or she just can't handle them. Maybe it's that strength and endurance piece with that. GI issues. What is that child's digestion looking like? Bowel movements, constipation. If our child is constipated, that does not feel good, right? And we need to look at that piece to make sure that that child is very regular. And if not, what do we need to do? Our metabolic system, the ability for the body to use the nutrients, our endocrine system, those hormones to feel hungry, to feel full. Some of our kids don't feel that. And so we have to dig a little deeper. And our immune system tolerating the different foods in our body. So just highlighting some of our development in that first year, looking at what our kids are developing or what we hope to be seeing. 1 to 2 months, we see that rooting reflex, suckling, and that suck, swallow, breathe pattern developing. 2 to 3 months, primarily nose breathing, but now we're seeing longer sucks for that child. It's becoming a little bit more fluid and coordinated. 3 to 4 months, we might see that child starting to bring their hands to their mouth, right? And that's what we want to see. And if that child has other things going on, and that's difficult, that motor movement, maybe we need to facilitate that, show that family, this is what we want to see, help them with that improvement with the quality of that suck, swallow, breathe pattern. 5 to 6 months, we might start seeing some teething, up and down jaw movements, and maybe starting to suckle on that spoon. Oral motor input is so important from that early age. And so, providing information for our families, giving them different options or suggestions on oral motor tools, maybe using a finger brush just initially, getting a Nook brush. There's so many things on the market. The other piece to be mindful of, some of them are very big and the child can only bring it to the front of the mouth. So those longer ones, right, to the side of their mouth, to increase that awareness. Sharing, some families will say, well, what if he gets too far? There's some with a guard on them, so you can't take them in too far if that parent is concerned about that. And it's really the parent doing it, right, in a very slow, gradual introduction. 7 to 8 months, increased tongue movements, rhythmic munching, emerging tongue and jaw disassociation, starting to grade bites. We might be starting to introduce solids, and making sure we let our families know this should just be a fun experience where that child is just exploring. And if we try it at 7 months and that child's just not interested, maybe we're going to give it another week or two, right? And then we're going to try again. And we have to expose our child, give them lots of opportunities before they're going to be able to do it. 9 to 10 months, that sucking pattern, emerging rotary movement. And we're going to talk about that a little bit more. It's really important. Increased jaw and tongue disassociation, and increased coordination for drinking skills. Sharing that with our families. We can give a little cup to our kids with just a few drops of liquid in it to start working on that. Not a big cup. Maybe it's going to be a nosy cup with that cutout so we can kind of control and help. A little medicine cup, just different things to try and expose. 11 to 12 months, increased jaw strength and stabilization for our children we'll be seeing, jaw, lip, tongue disassociation, more development of that rotary chew, increased lip control. So we see the child using their lips in that cup, around that spoon, to support that independent use. As we get to that early childhood, we're going to continue to see that transition from those reflexive movement feeding patterns to more purposeful active eating. And so we're going to see increased association with that jaw, lip, and tongue, increased stability for that child to be able to use their mouth efficiently, lip and mouth closure, that suck for drinking, development of chew pattern, and some more interest in different flavors, right? An interest in meal times and independence with that, as we see all over in that early childhood age. Those motor skills, breaking that down again, right? That proximal stability to that distal mobility. We have to look at that. Some of our kids that we see with that low tone, they may have that open mouth posture, difficulty with managing that drool and that saliva. And so giving them some cues, working together in that team collaboration for everyone to support that, right? To help share those strategies. Our kids who have the higher tone, they may have difficulty with grading, that sucking and biting. And those neuromotor skills, looking at that tongue tip lateralization to bring food to different parts of our mouth. And that rotary pattern again, to bring that food down, around, up, and grind that food, and that pattern to bring it to the back of our mouth, right? And to be able to chew and swallow it. Looking at positioning, this is so, so important. Can't emphasize it enough. If that child does not have enough support and strength, we need to provide that for them. If they are, leaning back, leaning to the side, leaning on their arms, it's just not going to be great for them. Therapy Source has this great visual that I wanted to share with you guys, but looking at that 90 at hips, knees, and ankles, helping our families use a footrest. So many times on these high chairs, go in to see a family and the child's feet are just dangling and the parent didn't really realize or know how important it is. And it could just take a couple, few minutes to bring that footrest up so that that child has increased body awareness and in position and space of where they are so that they can be more successful. And we can use all different things, right? We can use rolled towels, pool noodles, encourage our family to maybe use some of that strapping to give that child more stability too. We might want to encourage a slight forward anterior tilt, encouraging our shoulders over our hips for our kids. So they are in the best position and they are the most supported so that they can work on those skills to grade and coordinate their oral motor movements. Sensory processing and integration. This is a huge one. We could be talking about this for the full hour, but looking at those external factors. Some of our kids, they look at foods and they start gagging, right? So is it a component of that? That auditory piece for kids who are hypersensitive to auditory input. When we chew crunchy foods, that gives a lot of feedback auditorily. So is that difficult for the child? The touch of the food. If we don't expose our kids, then maybe, yes, the first time they're going to be like, yikes, my hands are sticky or wet, or it's too much mushy. And so giving them that just right challenge and exposing them to different textures, allowing for food play. And that might be having a conversation with the family. Maybe they're not used to that. Maybe they didn't experience that. And letting them know that the child needs to be able to touch the foods before we're going to bring it to our mouth and be able to handle that. And so we don't have to get messy from our head to our feet, but let the child. As our children get older, sometimes parents might say, oh yeah, if he gets that on his hands, he just freezes and he gets so upset or she can't handle that. Sure, wipe it off for them and then give them a little washcloth, a wipe, a napkin, empower that child to be able to wipe it off themselves, model it for them, encourage that independence. Olfactory, that sense of smell. Some of our kids are very hypersensitive and it's just too much. And so we might have to be mindful of that, be aware of that. If it's too much just when they bring it up to their mouth, they might not put it in and try it. Excuse me. And gustatory, the taste of the food. So looking at that, what does the child like? What do they enjoy? Let's build and expand on that. And then the internal factors that we have to look at too, the proprioceptive and vestibular system, our body awareness, our position in space, and that interoception, that mindfulness, feeling full, feeling hungry. Some of our kids can continue to eat throughout the day. Some of our kids never feel hungry. And so if they're not getting those cues within their body internally, it's going to be really hard for them to be able to sit and eat because they're just not feeling that and they're not interested. Different temperatures of food, and that piece again of toileting and elimination. What's going on with their bowel system? Are they able to go regularly? Are they constipated? What's going on with that? And asking those questions. This is not in your slides, but I did want to share it with you. Kay Toomey, this is a resource from hers and class that I attended. And really, she talks about this hierarchy. Before we can actually eat our foods, we have to tolerate the foods. Foods in the room with them, the food on the other side of the table. Maybe we're going to start really small. Maybe the food right in front of it, looking, maybe having the child put some in their plate if it's just too much, and watching, having that responsive interaction. Right? What is the child feeling as we bring it closer? Some of our kids might be fine with that. And so we can just kind of move along with that step. Interacting with the food. Have our kids assist in preparation. And that doesn't have to be a complex piece. It could just be stirring, dumping, scooping, using a variety of utensils. Maybe we're going to get a pair of tongs that have a pink flamingo on it or something. It's a favorite color that the child is going to get that buy-in to it. And then we're going to expand on that. Smells, what we were just talking about, being able to smell it. What do they prefer? Is it too much? Asking the child can probably give us a lot of really good information about that. Playing some sniffing games with that. Oh, this smells good. This smells sweet. This smells spicy, whatever that might be. Labeling it with those qualitative features and then touching it. And it could just be one finger, it could be with a utensil at first, and then we can build upon that. Maybe we're just going to put a little bit on their finger, and then can we touch it to your lips? And that's it. And maybe the child's going to use their tongue to lick it off, or we're going to give them a napkin if we're seeing that that's too much for them to wipe it off. feeding, again, is so complex, and we really have to set small, achievable goals. Again, our families want our child to eat, but we have to help them understand that it is a complex process that takes time. And then getting to the taste of the food, right? And it might just be kiss the food, lick the food, a baby bite, big bite, lots of modeling, turn taking, choice making opportunities, and being consistent with our mealtime routines. We're going to talk about that, but that's a really important piece too. And then we get to that eating part. And so we might need to help pace our child. A lot of our kids are overstuffers. They may put a lot of food. They may pocket their food. So, this is an opportunity also for that language. And so we might want to create that for our families, because sometimes we're working on a variety of different goals. If they're putting it in, let the family know. Maybe we're only going to give them 2 bites, and then we're going to work on them signing more, requesting more, pointing, using a verbal request. Maybe we're going to work up to 3 bites, and we're going to go from there. If anybody has any questions, please feel free to put them in the chat box. I'm going to send a quick pulse right now to see. You guys should see a little thumbs up and thumbs down, and you guys can just tap to let me know. Does this sound good? Anybody have questions? Great, thank you. And as I'm waiting for that, I'm going to go over this next slide on nutrition. This is a huge piece. A lot of our kids are eating the same foods. They're not getting a variety of foods. And we want to make sure that they are growing and developing and getting the nutritional care that they need. We might refer or bring in a registered dietitian, a licensed health professional who really specializes in that nutritional care. They will often do growth assessments, height, weight checks, might do head circumference, look at some food logs, right? They might ask the parent, please record everything your child eats for the next 2 to 3 days. Maybe it's more involved, and we're going to get a week long. And that can be very difficult for our families, and it can be time consuming and overwhelming. But that information can give us some, very valuable feedback on what's going on with that child. They might recommend some lab testing. They might work with children who have specialized health concerns, chronic disease, and specialized diets. Some of us may work with kids who have seizure disorders. They might be on a ketogenic diet. They really want to look at the different components. And so that might be somebody that we want to bring into our team to help us and give our families some additional support too. All right, great. In family and culture, when we're talking about mealtime and feeding, we need to ask these questions and engage in conversations to understand, what does typical mealtime and feeding look like in their family dynamic. We might have a different routine that we're familiar with, or we may assume, and if we're seeing the child at the clinic, it might just be different. And so taking some time to ask those questions. Does the family sit together? Do you feed the child first? Do you sit at the table? Do you sit on the floor? Do you use utensils? Or is it typically more hand feeding, self feeding? Who eats with the child, right? And so these are all really important questions to ask, so that when we come up with our strategies, we can discuss that. So, having respect and cultural sensitivity, always important, and getting those answers to those common practices during mealtime experiences for the child. And then that behavior piece, right? It could start as a motor piece. It could be a food sensitivity, whatever it may have started as. Maybe it was difficult for that child to eat. Maybe they couldn't handle that food. A lot of times there are some behaviors that develop. And so we need to reflect upon that. We need to rule out any medical issues, anything that may relate to the safety of the child while they're eating first, and then look at what's going on, right? We want strategies that include predictable and effective routines for our child. We want to model, teach, practice, and review expectations all the time of our mealtime experience. We want to identify motivators and interests, build in simple incentives for our child, right? In a positive way. Make those activities engaging and mealtime interesting for that child. Focus on the positive. You did a great job trying that. I really liked how you smelled it first and then brought it to your mouth. Having our siblings and other family members at mealtime also model and use these strategies, and really looking at that root cause, right? So think about the ABCs of behavior, right? What's the antecedent? What happened right before a behavior at that mealtime or feeding experience? What did the child do that interfered with that feeding? And then what was the consequence, right? Did we take the food away? Did the child get out of mealtime? What happened? And so really breaking that down and looking at the function of that behavior during mealtime. Was it to seek attention? Was it for access to something? Was it to escape or avoid? And was it related to that sensory piece? And so when we look at that, we can come up with better strategies that are individualized for that child. Always remember and keep in mind that emotional component for the child and for that parent or caregiver. It can be hard, but maybe asking some questions about parent history with food, anxiety, pressure. Parent might share that. It might be related to that parent's worry about, I'm scared if my child is going to choke. I'm scared if that child's going to aspirate, if that's a concern for them, have an allergic reaction. I'm concerned my child isn't growing and I need them to gain the weight, and that can be very stressful, or of a long-term diagnosis or something more involved. And so looking at that piece, how may that relate to the child's behavior that we're seeing during meal times, and breaking that down is also very important. This is a great resource that I wanted to share with you guys. It's from the Ellen Satter Division of Responsibility and Feeding. And we really need to look at that. We have that parent caregiver job of choosing, preparing the food, providing regular meals and snacks, making mealtimes pleasant for the child. That's really important. Modeling step by step, showing the child what's appropriate mealtime behavior, being considerate of the child's lack of ability or experience without getting into that same rigid routine, right? Being aware of what that child is having for drinks or snacks in between mealtimes. We want to make sure that our child is developing that hunger in between, and letting our children know that they can let us know what they like, what they don't like, and there's some choices in that. The child's jobs, right? That child's gonna eat, but how much is appropriate, and modeling that, presenting them with that, let them participate in that learning process, and how to behave at mealtimes too. So this is a great resource. Check out that website. There's so many more great resources too. General feeding goals for our children. We want them to be ready to participate in feeding, be alert, be engaged, meet the child where they're at, right? We are not going to be able to create huge changes in 1 week or 1 month, realistically, right? Maybe we get that and that's a win, but it is small and gradual. For us, we may think, oh, the child has this one yogurt that they love, and we'll just add 1 spoon, 1 tablespoon, or even 1 teaspoon of a different yogurt. That might be too much for the child, maybe texture-wise, taste-wise, color-wise. It's too big of a change. And we might just have to start with 1/4 of a teaspoon, and that is it. And then we can build. And maybe that child's going to be successful for the next 3 meal times or 5 meal times. And then we're going to add, 1/2 teaspoon and build from there. Model, create routines to help the child know what's expected for them. Marcia Dunn Klein refers to food rehearsals, right? That's what we want to give them. Opportunities to try it, rehearse it. We can model it. Lots of exposure, lots of repetition. Reading the child's cues, being responsive. Force feeding the child does not work, right? And so helping our families understand that, that can cause a lot more challenges down the road. And so we really want to focus on setting that child up for success with the just right challenge. And that changes day to day for that child. Maybe one day they can handle a little more than the next. And so we as the adults have to help identify what's appropriate for that day. Mealtime routines and expectations. Typically, We should be giving our child 3 meals and 2 to 3 snacks throughout the day. That is the goal. Children must feel safe and secure, right? Again, that responsive feeding environment. We want to respond in a timely manner for our child too. Offer them options that they can manage, that they're interested in, and then grade and adapt that. Meet the child and the family where they're at, build from there. Ask about how long do meal times last. Sometimes families will say, oh yeah, we're at the table for an hour, hour and a half. That is just too long. Everybody's exhausted, right? And so maybe identifying that we need to kind of break it down. Maybe we need to build in more snacks to make sure, or more meal times so that child's getting that food. But average speaking, 15 minutes for snacks, 30 minutes for meal times. Make sure it's developmentally appropriate. What are we giving that child? The amount of food, the type of food, what can they handle? Also looking at that parent or caregiver child attachment and bond. It plays a huge role in feeding. The child has to trust that person, right? And know that their needs are going to get met, that they're not going to be overwhelmed. And if they're on edge, it's going to be difficult. Letting the parent know, don't hide it in the spoon. Let the child see it. That might not support that trusting bond in relationship. Making sure that food positioning, location for that child, is it appropriate? Can they reach it? Is that child secure? Have that postural support? Look at the distractions in that environment. For our child, maybe we need to have a more quiet environment. Maybe we're going to have some calm music for them. Maybe we're going to kind of turn their chair instead of being open to the classroom and daycare where they can see all these kids moving around. Maybe we are going to face that child so they're looking at the wall behind us where there's less visual distraction, looking at the auditory piece too, if there's just too much going on. So really looking at that piece, helping that child be motivated in meal times, and decreasing that fear and that pressure. Always modeling for our child. That's so important. And thinking about the language we're using during mealtime, that it's positive. We're talking about the different qualities of the food. It's crunchy, the color of it, maybe the shape of it, and praising any positive attempts that child uses. Maybe we're going to use some motivators, right? Maybe that child really likes shapes or letters. Maybe we're going to use letter pasta. Maybe we're going to cut that toast, sandwich thin bread that's really manageable for our child. We're going to get cookie cutters and do different letters if that child's interested in that. Maybe we're going to let them put a few sprinkles on something, and that's going to be exciting for them. So think about that buy-in for that child. It's really important for that. And talking about that time again for those meals and snacks, wanted to just mention Coach Mel. We're going to talk about her a little bit later, but she really talked about that eating time versus that growing time. We have lots of kids who are grazers throughout the day, and parents may feel like, well, at least he's eating or she's eating, and that's important. But being mindful and allowing that child to develop those hunger cues internally is really important. So important that presentation of the meals, making sure it's an appropriate size plate for the child, appropriate portions. General rule of thumb, just if you want to keep in mind, 1 tablespoon per year of age for about up to 10 years old. That could be, just a little tip to keep in your mind. We want to try to give 1 protein, 1 starch, 1 fruit or veggie every meal. We don't want to overwhelm the child and give them way too much on that plate, or switch. Working with one family, the mom said, oh, meal times are so difficult. And she'll say she wants this. And then when we give it to her, she doesn't want that. And then she wants something else. And we go through maybe 5 or 6 different foods and requests during that one mealtime. That's too much, right? And then everyone's exhausted. And so having a discussion of, let's try to give 1 protein, 1 starch, 1 fruit, veggie, 1 preferred food maybe on there. And that's enough. So having that discussion too. And exposure, again, we have to expose our child to food several times before they're going to eat it and be interested in it. Feeding is a slow process, right? Again, it's not a sprint and we have to go slow. Give that child lots of opportunity to practice, giving them opportunities. Again, using that positive language during those mealtime routines is vital. These are some of my key feeding mealtime gurus that I wanted to share information. All of their websites have lots of great info. Lori Overland, she does a lot of talk tool courses, and she had shared feeding is one of the first things we do as humans. Infant feeding is driven by hardwired synergies and reflexes, requires the interaction of so many systems, and we have to be mindful of that, right? Think about that. Take a step back and to really break down those components. Susan Evan Morris and Marcia Dunn Klein, great resource, pre-feeding skills book. It is fabulous if you guys are looking for more information. Coach Melanie Potak, she's got several great books. Her website is wonderful. She does little talks, little videos, several books that she's got out there, online resources that are just really fabulous. Marcia Dunn Klein, she developed the Get Permission approach, and we talked about food rehearsals, as she refers to, modeling and practicing. Those opportunities need to be built in on a regular basis. So her resources and classes are great. K2Me, a lot of us might be familiar with the SOS approach. That steps, again, of just tolerating the food, interacting with the food, looking at the food, touching the food, smell, right? All of those components. Looking at that piece of picky eating versus problem feeders. There's a difference in that, and we really need to look at what is that child eating when we start seeing that rigidity. And he only eats chicken nuggets from McDonald's and he won't eat any other. That might be a little bit of a red flag that we want to ask some more questions and get some more information. Elizabeth Clausen, Carol Elliott, Mealtime Misery Course. That was wonderful. One of the pieces that I really took away from that and mindful of is the different textures of food, and a lot of different people have different categories or classifications, but thinking about that, right? What is that food texture? How does it feel in the mouth? What's the dispersion of that food too? And so they developed 5 different levels that can be helpful. And Nina Johansson from Food Smart Kids, she's got some great classes, lots of good information, looking at that early development and suckling, suck, swallow, breathe patterns. And she has the AEIOU approach. So just giving these resources because we're just touching upon it today. These are some great resources for you guys. This was a good one on the SOS website. Wanted to share. They have a wonderful table on there of development milestones that you guys can access that looks at the age of the child preterm, and then goes through motor and postural stability pieces we look at, looks at the oral motor skills and the sensory component. And that chart goes from all the way up to 36 months. And so it's just a nice one if you want to kind of take a step back, look at that. They also have this nice resource on the red flags of feeding, right? And we kind of identified some of these in that one of those first slides of what are the concerns. And so this could be something that you could look at where do we need to make a referral to a feeding specialist to help this child and family with what's going on. This is another great resource that I had to share from Coach Mel. Just looking at this chart, right? What are foods that this child consistently eats, sometimes eats, and what they've eaten in the past? And what do they eat often? And looking at that, gathering that information and that data, and then going from there. So this might be a really nice chart that you can share with your families or use within therapy too. I love using visuals. I think that can really help. This is just a sample, but you could use any kind, right, of a placemat. Get that child engaged in mealtime before the eating component, right? That beginning of mealtime of getting your placemat, maybe getting your cup or plate, bowl? Which one do you want? Maybe we're going to give some choice making opportunities with characters, colors, getting utensils. Well, which spoon do you want to use today? And maybe there's the construction one, maybe there's a preferred color, maybe there's a preferred character on that. Maybe we want to get a longer one or a shorter one that the child's going to be more interested in, or is going to be more appropriate for their grasp and motor ability too. So using whatever that child likes. I also like using visuals like this, right? Maybe we're going to use this snack time, and maybe we're going to have 3 pictures of what that child can have for snack or typically has for snack, and they're going to use that Velcro to bring it down to tell us. Maybe we're going to use the visuals along with that auditory piece for that child. Maybe we're going to use a little visual strip here to help that child break down those pieces, slowing down the pace, right? Look at the food, touch the food. We have this visual strip, we're modeling for the child, and then that child can actively participate too. I smell the food and exaggerate some of these pieces, right? And that child's going to get it. Oh, I'm going to take just a little taste, right? I'm going to lick it. I'm going to kiss it. Take a baby bite. Oh, I hear that crunching. Let me hear you crunch, right? With that veggie stick, with that puff, with that cereal, with that cracker, whatever that might be. Kids get intrigued. That interest develops. And then we can talk about eating. If we're seeing our child who's really overstuffing, sometimes I will use this other visual strip of we take a bite and then we chew, 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 swallow, and eat. And I might do it, I might exaggerate that, I might use a mirror within that interaction for that child. Oh, look, I'm all done, and open my mouth. Oh, you check, are you all done? And then we can have that interaction to really slow it down, to help increase that awareness for that child, to make sure that they're eating successfully and safely. Maybe we're going to engage in some turn taking with that parent-child. Maybe that child, oh, you give me a bite of the cracker first, right? Oh, I'm going to take a bite, and then we're going to chew, 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 swallow, or we're going to go through that sensory piece of looking, touching, smelling, tasting, eating. Now your turn to take a bite. We're going to go back and forth with that, and that can be a great learning opportunity for that child to be actively involved with that mealtime. Teaming and collaboration, this is huge in every aspect of therapy, but with feeding and mealtimes also. We need to work together. We need to look at our own discipline-specific expertise, help our families understand where's that root cause, what's going on, what are the strategies that we want to go in that hierarchy to really support that child, right? Help them identify ask them, what are those concerns, break it down. Having our parents be participating in our caregivers. It does not matter if that child eats for us, the therapist, right? We're not there every day or at every mealtime. And so we really need to empower and build that caregiver capacity for our child, for our caregivers and our parents. Setting small, achievable goals. And this happens through that ongoing daily or weekly, whenever we're seeing that child, but that communication, sharing information, sharing those strategies. And that has to include the entire team. It cannot just be that one person. So maybe we need a communication notebook. Maybe we need emails with permission or texting, phone calls, whatever that is. So that child is getting those strategies consistently in a variety of different environments to help them succeed. It's really, really important. And when we're doing this, be mindful of how we're sharing those strategies with our caregivers, visuals, maybe videos, written, pictures. That can all be really helpful. If it's a daycare provider, maybe getting permission and taking a little video. We all have our phones, right? And we can take a quick little video using maybe certain auditory cues. Just be really mindful of that and share it with everybody. And those coaching techniques, right? That's really important. Identifying the strengths and the needs, supporting that relationship and interaction, and really emphasizing again that it's a learning experience that moves very slowly sometimes, and we have to be very mindful about our goals to really help that long-term, lifelong relationship between the child and food. that hard work and thought before the activity. This again goes with so many different things that we do for our children, but with meal times too. Set that meal time up for success. Look at the time, the environment, the transitions, the support. Where are we feeding? How are we feeding? Where is the child sitting? How have we prepared them for that beginning experience of mealtime, that middle piece of mealtime where we're engaging, and that end of cleanup? Having the child bring their dish to the sink or throwing something away, that is great for direction following, for letting them know we are completely all done with that, right? And so again, modeling that positive language, inviting that child to observe, to participate, giving them some extra processing time. Our kids sometimes need a little additional time. And sometimes we are anxious, our families are anxious, and it's just too much bombarding. And so calming it down, slowing it down, builds their confidence, give them opportunities to make choices, to empower them, giving them some control, right? We might give them a choice of two. We're picking the two, but the child gets to pick the one out of that. Making meal times really comfortable, positive, calm experiences to support that engagement and participation. Making sure we're decreasing that stress, that anxiety, and that pressure to eat. And prioritizing those needs and goals. Maybe we're trying to work on so many things within that meal time, and we have to break it down and just say, these are the 3 first important steps. And once we achieve that, we can build upon that. Those strategies that we might include during our meal times, redirecting our child, modeling consistency with routines, creating opportunity, reviewing and managing those expectations. That might just be, we are expecting you to sit at the table. Maybe we're using a timer. Maybe we have some visuals. Is it developmentally appropriate? Using that multisensory approach, right? So those auditory cues, visual, touch, a variety of those, identifying motivators and stressors and being mindful of that and continuing to visit that, because that could change over a month, 2 months, 3 months. And so we have to continuously go back to that, and scaffolding, prompting for our children. Again, we have to coach our families and caregivers, empower them to support those mealtime experiences, because we are not there for every single one. And so that is so key for our families. All right, let me send a little, been talking a lot here, so I'm going to send a quick pulse check. And you guys can give me a thumbs up or down on here. I know we've gone through a lot of information. I'm going to peek down at some of these questions because they've been coming in and I haven't looked at them. So let's look at some of these. OT in school systems, right? That can be really hard because we don't see our families. And so having that communication is important. And also maybe reaching out to private therapy therapists or having them reach out. It can be hard. We all have very busy schedules. It's really hard. But that collaboration can be really important and helpful when we're working with our kids. Joanna was asking, are we going to review bottle weaning at all? Today was just kind of touching upon these pieces. There's so much involved in that and breaking it down. Some of those resources that I shared with you and individuals could have more, but we're not going to get into the details of that today with our limited time here. Okay, just looking at these questions. All right, making sure I have any other questions. Okay, so Michelle had asked some great resources. Those I did share with you. And if you go to those individuals' websites, you will find lots of great tools. Tube feedings, we didn't talk too much about that. Depending on where the child is at with that and making sure we have medical clearance, even if they're not having foods, but giving that oral motor input is really, really, really important on that. Let's see. Engage in feedings, bite and chew. So this was a question by Madison. Feeding aversions. I have a child with feeding aversions who receives GI tube feedings placed directly to picky eating and failure to thrive 3 years ago. I acquired the patient 2 months ago. The family is frustrated with lack of progress, but I truly feel that the motivation to engage in meals by mouth is due to dependence on the tube and regular feeds. He will engage with presented foods via sensory strategies and even bite in food during sessions, but refuses to swallow. So many different things, and you may have the answers to this, but I'm going to want medical clearance, first of all, on the types of foods and liquids that he is medically cleared and safe to have. When was the last feedings, swallow eval to make sure that that's safe, most first important. Second, are they continuous feeds? What is the schedule with the tube feeds? And like you mentioned, is he feeling that hunger, right? And a lot of times with our kids who need those calories, engaging in that mealtime experience and exposure and getting that interest and that food hunger in that opportunity first before we supplement is really important, because is he getting full and then just not interested? So that would be another one. Looking at that history again, where is the family at? Looking at how much calories they're getting through the tube feeds to, what are the oral motor skills that child, where's that at there? So kind of breaking it down and going through kind of what we went through today and checking those off, right? That positioning, the experience, and then moving from there. So lots to kind of ask and work through, and supporting that family, because you said they're really frustrated, right? And so acknowledging that this has been really hard, and then maybe kind of coming up with a plan from there. Let's see, any questions on here? Joanna was asking, I have a 13-month-old and we're working on feeding, straw learning, and bottle weaning. So that's why she was here. So again, looking at the oral motor piece, that jaw stabilization, lip closure, looking at the type of straw, right? Looking at the type of cup that we're working on, looking at the bottle. What is the family exposing this child to? How much experience? What's the routine? Is the child interested? Allowing some play with that cup, right? It doesn't have to have liquids in it at first. Maybe we're going to do some just exposure to that, and starting as a starting place for that. I think I got through all these questions. I'm going to look again. If anybody has any, please do type them in that chat box. Claudina was saying that studies are showing that snacking is a major reason, right, or contributor to childhood obesity. And again, COVID, everybody was home, parents were working from home, things were challenging, we're going back, but maybe kind of starting again fresh and talking about what does mealtime routine look like for your family, for your child, establishing, it's great that he eats a lot of different foods throughout the day, but maybe we can hone in on certain meal times and snack times to support the child. Let's see. The overstuffing, Tammy, you had asked some techniques to prevent overstuffing. A 5-year-old with Down syndrome who overstuffs, sensory seeker, requires increased proprioception. So for this kiddo, I would definitely, some strategies, I don't know the child, but maybe using some oral motor input prior to mealtime to increase that awareness for that child. So maybe when we get into our chamber, maybe we're going to give them some oral motor tool to use. Maybe if that child can handle that, some vibration can be very alerting, a lot, but that could increase that awareness. Temperatures of foods, cold food is sometimes really alerting. Maybe we're going to give that child a sip of cold water, cold juice, cold whatever that might be, to first get that awareness in there. Proprioceptive input, so that could be through feeding too, right? And so can that child handle some more chewy foods in between to give them that input? So that could help. And then those pacing strategies, maybe we need to break it down and you just get one piece and we're going to eat that. And then we're going to work on requesting more, getting more, turn taking with that to slow that child down. All right, let's see if we can get one more on here. Let's see. So Anne-Marie asked a question on any tips for the child that doesn't have that sense of hunger. So we need to kind of look at that piece. Has that always been that way? Is it something that started? What is the age of that child? Involve that medical team too, and that pediatrician once we get some of those questions to really figure out, is there something going on more medically, metabolically, hormone levels for that child. It can vary depending on what's going on. And so kind of asking those questions, looking at that mealtime schedule too, does that child have opportunity to get hungry also? That's going to be an important one to really get to the root cause of what's going on. All right, Nicole asks, suggestions on the child that has behaviors or negative responses when the therapist arrives to work on feeding therapy. Mom becomes frustrated and reports she does well at other times. Child refuses to sit in her seat and engages in atypical behaviors during therapy time. I think we need to kind of reset, right? We're seeing this pattern, so let's break it up. Maybe we're going to first just do some play-based feeding, right? And we're not even going to do real food. We're going to get pretend food. Maybe we're going to use their child's favorite character. Maybe it's Woody from Toy Story or whoever, like Mickey Mouse. And we're going to maybe play in the play kitchen, or we'll play Velcro food, or we're going to use puppets, or we're going to just kind of model through play, what does mealtime look like? Take the stress out. Maybe that child sees the therapist and knows, uh-oh, yikes, that fight or flight. And now I am so stressed out. And so we got to break that pattern and start small, make it positive. And then how can we transition to that? Maybe we're going to do a pretend picnic or tea party, right? And have some fun and pretend. Maybe we're going to do it outside. Weather's nice in most areas right now. Maybe it's too hot where you are, but we're going to kind of just pull it back, right? And break that pattern, and then figure out, okay, have we decreased some of that anxiety, and how can we come back to the table in mealtime? Are we going to get some buy-in with some favorite characters on plates or spoons? How can we empower that child during those meal times? So hopefully some of those strategies help you out. Let's see here. I think we may have gotten through most of these. All right, I'm just going to go to the other one and just check if I missed any. Calvert asked about food on the spoon, encouraging chew first and swallow before taking more to mouth. Oh, with Tammy. Yeah, that would also be a great strategy. Increasing the flavoring of food. Absolutely, right? Some of our kids who are sensory seekers, thank you, Nicole, this is a great piece to highlight. They need more flavor or taste to that. Maybe the parent isn't as aware, maybe their older child didn't, but tartar foods, spicier foods, more flavor, and kind of playing with that aspect can also be really beneficial for our sensory seekers that need more input than others. All right, so just wrapping it up for us today. Oh, my slide doesn't want to move forward, so I'll just try another way of doing this. Okay. All right, so that success. Set that task, that mealtime experience for success. That just right challenge, prioritizing needs and goals during mealtime, really important. Sometimes we overdo it. It's okay. Figure out what went wrong, move on from there. Use it as a learning experience for the child, for the family, for us. Just kind of pulling it back. What went right, what went wrong, and what can we do different next time? And really working together as a team. Can't emphasize that enough, to really figure out what's going on, because feeding, again, is so complex, so many variables that we really need to look at all of them to make it successful for that child. So thank you, everyone. Here are some other courses, webinars that I do through Summit. So I wanted to share those with you guys. If anybody has any questions, I'll stick around for another minute or two. And thanks for spending your lunchtime with me. I really enjoyed it and look forward to other courses. Thank you.